Yeah, yeah, huh? Yeah, yeah, yeah. لما يوجع الجدار ما
Welcome to
ناخد
the
شقق
first
شغل
episode
باقي
of
في
Hadi
حمله
Radio.
كل واجب تاكسي.
My first guest is Dr. Hadi Halazun, who I've known for 35 years. We're both 5 years old, so to the extent that you can know someone at age 5. I'm lucky to have him as my first guest, not only because he's been on the front lines of the COVID-19 emergency efforts in New York City, which is the epicenter of probably the global pandemic, but also because I know him so well, it will ease my nerves, this being my first podcast. So, Hadi, welcome.
Thank you.
Thanks for coming on.
Anytime, man.
So, I'm sure you're sick and tired of talking about your experience as a doctor in New York City. It's April 11th today, which is somewhere around the peak. Hopefully, the peak isn't far from now. Do you think that you're seeing the peak, or there's a different way to measure it? How do you think of it?
If you were to ask me mid-February or late February about the coronavirus, I still thought it was overblown as an issue. You know, the timing then, Italy hadn't seen many cases, and so it was just more or less isolated to China, and it was often very hard to understand or trust whatever information is coming out of China. Slowly but surely, after reading the experiences in Italy, I realized this was a bigger deal than I or anyone had expected. And it's not until I actually started seeing some of the patients that are coming in and figured that this is much different than anything we've ever seen before, both on a pathophysiological level and on a global community level. To get to your question about have we reached the peak or how am I thinking about it, it's complicated because the peak is dependent on where you live in the world.
I'm talking about the peak for New York City specifically. And
peak
do
for
you
New York
think
City,
of
yeah.
it as a rate of admissions or rate of death or how packed your hospital is?
The way I personally think about it is not in terms of death, even though that's the most tragic number to follow. I think that the more correct number to reflect the gravity of it is the number of people who are on ventilators. And in fact, in my hospital where I work, we have around more than 200 people on ventilators, but our death rate on the ventilator seems to be lower only because we have A, the expertise, and B, the capacity to grow the staffing, both doctors, nurses, respiratory therapists, and so on. People are volunteering to come. So the lack of shortage of expertise is really what's really helping our numbers, our death numbers, to be low. But as I said, death is not what I'm mostly concerned about, even though it is on the personal and on the individual level what's most tragic. I think if you look at the pandemic and the impact on the communities, I think those intubated on ventilators will ultimately, and who make it, ultimately will be a bigger number to worry about. And mostly because, once you're on a ventilator for 2 weeks, you need a very long recovery time. And I think the capacity to accommodate those people in nursing homes, in rehab facilities, and so on, will be I'm not so sure about the capacity. I'm not sure what capacity places have to accommodate those people.
Yeah.
So yes, I think we've peaked in number of cases. I think it's still a very long road ahead.
Yeah. I remember you sent me a week ago a photo of the hospital lobby, which is probably the same as most hospital lobbies in the US or in big cities there where you have beds in random places where there usually wasn't any.
Yeah, and these are to accommodate, keep in mind our hospital has stopped operating any outpatient, for the most part, any outpatient procedures, any elective surgical procedures. Clinic visits have been converted to video visits, and one has to question, where are all these patients? The hospital was operating at 85 to 90% capacity prior to this. And granted, a lot of the capacity was taken up by elective procedures, but I don't know the numbers, but I'm not so sure it's the majority of beds The majority of beds, I don't think, were taken up by elective procedures. And
I think they
I don't know that.
were emergency
Let's
procedures, some of them.
Yeah, people get admitted for a lot of medical and surgical admissions for emergent procedures. I don't think it's I don't know the numbers,
Yeah.
but where are they? You know, one has to wonder what's happening to the population that's sick with things other than COVID. Are they staying at home for fear of coming to the emergency room and thus becoming sicker? And are we going to see there's people
Oh,
suggesting that we're going to see a surge of non-COVID patients come through. And so what they're building in the hospital is to accommodate that surge.
some things yani they're out of anybody's control, like a fracture or a appendicitis. Those have to be
Yeah,
walk-ins. They can't be on video call.
exactly. But we're seeing a
So,
reduction of those. We're seeing a
well,
reduction in number of heart attacks, reduction in admissions for heart failure, for
wow,
fracture. Everything's down. And one
wow.
wonders why. Is it because people are staying at home and not going about their daily life? Or are people not coming to? And I think it's too early to tell what the reasons are. I think we'll only be able to figure it out retrospectively looking forward.
For accidents, it's obvious. When you're at home, you're less
Yeah.
likely to get into an accident. But if it is also the same for pregnancies, for delivery, does your hospital see delivery walk-ins
Yeah, of
down
course.
as well?
Yeah. No, because you're going to deliver, and you're not going to deliver at home, I hope. So
Or if you're close to the end of your term, you probably left New York.
I scanned the delivery floor. And they have a lot of COVID positive patients. You know, it's a different population. They tend to be younger and healthier, even though
Yeah.
pregnancy is a risk. You can't go elsewhere. And usually the way the system works here is that you're attached, for the most part, to an obstetrician who works at a hospital system. And so you know where you're going to deliver months in advance. It's not like you decide day of, you know. From a healthcare professional's perspective, there's two dates that you think about: the date of when the lockdown in the community is done, and the date when your work and your hospital goes back to normal functioning. And I think the latter will be much more delayed than the former, because I think the hospital has just completely transformed just to accommodate COVID patients, completely.
Wow.
And I think those will still come for a very long time. And those who are there, who are sick, are going to be there for a while, sadly.
Wow.
Yeah.
I don't know if you're allowed to talk about this, but are you guys using the hydroxychloroquine remedy or as a cure?
Yeah. So are we using the hydroclock? So we do use it, yes, but we don't use the combination that has been touted in the media or that was studied in France with azithromycin. We just use hydroxychloroquine. I think that's standard across all hospitals now to use it. And the reason we use it, and we use it only for 5 days, and the reason we use it is because, generally speaking, given in the controlled setting of being in the hospital, there's really little to lose by just giving hydroxychloroquine for 5 days. It's a very old and common medication, you know, and the data that supports its use keeps on changing. And honestly, I think the risk, the way we see it, is that the risk is low enough.
And what stage is a patient eligible to get it on? Is it before ventilation, or usually he has to be ventilated to get it?
No, before ventilation.
Before, okay. Is our hospitals like already they have a month of data, but is it useful data or it's not been compiled yet? If you ask someone,
I honestly, you know, any data that comes out of this so far, for me, this is my own personal opinion, has to be taken with a grain of salt, with a little bit of skepticism. I think there's two reasons. One is you know, we don't have long-term data, which is important for all of these kind of things. And secondly, I think there's an urge to come up with there's this drive to be the one drug, to be the hero, to be the blockbuster, to be the person who solves this quandary that we're in. And I think that inevitably pushes to bias, inevitably pushes to publication early. I wouldn't be surprised if in a year from now, when all the dust settles, if it settles in a year from now, that, you know, a few things that we thought work don't, and few things that we didn't think work do. And so what I do personally is our hospital has developed protocols for how to take care of these patients, which I won't get into in detail, but having started the work in ICU more than a couple of weeks ago till today, we've been adding and taking away from that protocol, and I just follow it. I don't question, and I, these are people who are leaders in the field and are very knowledgeable. I'd rather personally stick to what the people who are professional doing it, as opposed to getting dragged by, the armchair experts on Facebook and the media. This is why I don't pay attention to much of what we see on social media.
Yeah.
It makes my life much easier in that way.
Would you feel like you're in shock, emotionally in shock over the scale of what's happening, the people dying? I mean, how are you coping with it?
It's I think the combination, what is difficult about the situation is that it's a 24/7 presence in our lives. Obviously for everybody, because your life has changed because of it, not just mine, right? But usually when you go to work, for me, you sort of can keep it at work. I'm very good at separating my work from my personal life. Even when I'm on call and I get calls at home, I still have a separate mindset. Unfortunately, I feel what's been difficult is that I can't do that with this thing. And whatever I do at work, it follows me home. You leave work and you're treating all we're treating is COVID patients. And then you go home and all you're seeing on the news is COVID. There's really nothing else that's being talked about between news, calls. Our life is upended.
Yeah, especially since you have family and you have to worry about them, and it's always an issue.
I worry about my kid, but I mostly worry about my parents, honestly, because they're the ones at risk. And as you and I know, they had a close friend who just passed away with it, and it just brings it that much closer to home. And that's what worries me mostly. Plus the inability for me to hop on a plane and go back and see them and help and be there. It's just, I try not to think about that, because right now it's not reality. But if that were to become reality and I just can't go back home, it's it'd be tragic.
But imagine this is the case with so many people. Even our very close friend whose father passed away a few days ago,
they can't see their family.
They can't see their mom, who became a widow. They couldn't bury only one.
See, I think
it's unbelievable, the cruelty and the brutality, and you guys see it as well, because when somebody dies at your hospital, the protocols.
So I should make a comment about that. The first is, it sucks. It's awful. I can't imagine not being able to mourn. But I think the way Jordan has handled the lockdown and the pandemic is something to be admired. With that said, I think preventing people from mourning together is a big mistake on their part. I think they should test the families and let them be together, because ultimately that's what's most important for them. So, and to translate that to what we do, we don't allow families in our ICUs unless someone is actively dying. And actively dying is a term we use, but it's someone who we think that our efforts have, become futile, and we are almost certain that they cannot make it. And we have transferred their care from something that focuses on advancing the care to something that focuses on comfort. And if we reach that point of comfort care, we allow one family member to come be with them. And I think, Jordan, as the government, has done really well, but not allowing people to mourn. And I think all governments are doing the same, but you have to allow them to at least go to each other's houses. Don't have a funeral is one thing, but to prevent the daughter from seeing her mother is
it's so cruel.
You can test them.
I mean, Jordan, yes, as you said, it's commendable. The quarantine efforts, the lockdown efforts have been very effective, and because Jordan is effectively a police state, we're able to implement the lockdown fully. The extreme measures they're taking with not allowing a mother who lost her husband for her daughter to come and hug her under threat of arrest, basically. It's obviously they're saying, and it's for the mother's benefit because she is above 65. She's an elderly person. Can you imagine grieving at home by yourself without your kids?
And from a medical standpoint, if the mother's been living with the now deceased husband, she's being exposed to it for days. She either is going to develop worse symptoms or she's already developed, and it's almost impossible that she doesn't have either now the antibody or had been infected.
That's true. Yeah, on top of the loss and the lack of closure, you have then a feeling of an injustice on top of that.
Yeah.
It's unbelievable the amount of pain. Everybody I know is in shock just thinking about losing a loved one at this time and not being able to mourn or bury or console.
Yeah, especially in our culture, the mourning period and the aza is such a big part of our of the positive part of one of the best parts of our culture are these moments.
The social the deep social connections, even though some of them are superficial, that occur during the 3-day funeral.
Yeah, but these bring out the best in our culture. These moments bring out the best in our culture.
Yeah.
We had it's a sad story, but we had a patient who got admitted. She's in her 80s and she's on a ventilator. And then a day or two later, her husband gets admitted. And then a day or two later, her brother gets admitted because they're all living in close quarters. The husband has passed away, and so has the brother. And she has no clue because she came in first. So when we wake her up, if she makes it, she's going to wake up both a widow and have lost her brother. I just can't imagine the world that she's going to wake up to after that.
Wow. You mentioned something about not being able to leave your work at home, dealing with COVID-19 at work, not being able to leave it at work and come home and kind of separate. Me as a business person, as an entrepreneur with employees that are waiting to hear back on their future and what's happening with their company, I'm living a completely different life than a doctor is, or a nurse, or anyone on the front lines is, because I'm stuck at home. The emotional challenge that I'm feeling is immense. I mean, I'm lucky that I have a lot of tools that I've learned over the last few years, emotional management tools that I practice, like meditation and a lot of stuff like that. But the last couple of days, I've been waking up multiple times, like waking up at 5 and then maybe at 6 and then at 7 and then at 8, waking up and staying in bed and going back to sleep, but with the thoughts of having to shut down my business, with thoughts of the government penalizing my business for laying off people, which is becoming a thing now. The government of Jordan isn't allowing companies to lay off people unless the company has renounced their business right to do business completely. So it's very harsh.
So let's just to clarify to the people who don't know what's going on. Have you laid off a lot of people?
Honestly, I'd rather not say the status of my employees because there's a couple of nuanced choices you can make between
I understand that.
Between unpaid leave.
So let me rephrase the question, or let me make a statement about that. Anna, I think that while it's challenging for me to be in the front lines and we can get hurt, I think what makes it easier is that people are cheering and it's a valiant effort. Anything we can do is great because it helps people, right? So you go home with a sound conscience. I think your position is way harder than mine in so many ways, because you need to look out for your family, but you also need to look out and your well-being and your financial well-being, and you also have a responsibility towards your employees, which may or may not agree with the decision to lay off or not lay off or whatever it is.
Yeah,
I cannot imagine having to be responsible for that kind of decision when ultimately, there's almost never a good one. There's
No,
never a
no.
good
Listen,
solution.
we're in a lose-lose scenario
Exactly.
right now.
As,
There
as
is
a business
no.
as a business owner, you're really in the worst
Yeah,
position.
yeah. I envy people who do not have a business to run and employees to deal with. Definitely, at
It's
this moment.
sadly in this world we have to always keep it in perspective that you're better off not being infected, being alive.
Oh
You didn't
yeah,
lose a family. Yeah, yeah, of course.
yeah, yeah.
But second to that, being a business owner, I think is
I mean, my business relied on the tourism sector in a big way, and
interesting.
I
I never knew that.
currently have no income. The
Wow.
business
Yeah,
doesn't
I
have
mean
cash,
you're
doesn't have cash to give to pay my salary as a manager. So I'm not getting a salary. I'm basically going to be working to rescue my business or liquidate my business, whichever is more reasonable to do over the next quarter.
yeah.
And I will be doing it for free. And if I decide to rescue my business instead of folding my business, I will be taking out a loan that I will be
Wow.
paying back later myself just to keep it alive for could be 6 months, could be a year, could be 2 years, keeping it alive without income just to keep it alive. And then hopefully one day the business model is sound enough for it to make money in the new post-COVID environment. Well, I just got off a conference call by a renowned corporate lawyer who is deciphering the latest government laws over what small businesses should be doing right now. And the people that were calling in were everything from a hair salon to an architectural firm who lost all their business. Uh, I mean, everybody is suffering. And his answer was to all the questions, whether it's are there going to be unemployment benefits by the Social Security of Jordan, which has been silent right now, which has shamefully been silent, hasn't been willing to offer any unemployment benefits, to, talking about take every month as it comes, because every week there's going to be new directives. The month of May is going to look very different, and we're going to be in a different place than month of April, could be worse.
And Ramadan is coming, which
Can't,
slows business
yeah.
down anyway.
Yeah, I mean, Ramadan now, we're not even thinking about the slowness of business in Ramadan because if you're in retail, like half of my business is retail. I mean,
Yeah.
the scope, the scale of the disruption, the global disruption is unbelievable. I mean,
And I think what you're describing on the small business level is also going to be reflected in globally as countries. In other words, I think small countries like Jordan who can barely swim and can barely make it on their own are really gonna suffer much harder than
oh yeah,
countries that can obviously have a good economy. I mean, it's usual, like developing countries are going to suffer more. And I think Jordan took a really interesting bet, and I'm not following every country of its size, but a really interesting bet that its medical system will not be able to accommodate the surge of
absolutely,
patients.
absolutely.
And I think they're absolutely right. But it's hard to explain to the average person who's not getting an income that these preventative measures are better because they feel so bad.
A
Yeah.
month, 2 months ago, we were downplaying this. I mean, I remember the first week of March, I was planning purchase orders for my business as if things are going to stay normal. A week later, schools
Yeah,
are shut, and then a
yeah.
week
I was
later,
planning a trip. I was
we're
trying to trip to Miami, man, and I thought, we're gonna have a few days
yeah.
off. Oh, I don't go, and
But I mean, aren't we? We're so complacent with our lifestyle. We're almost on zombie mode because Chinese COVID cases in February were insane. Were dangerously high. What were we all thinking about? And also Italy and Iran were having insane cases in February. We
yeah.
were
I
just
think,
chilling. Like, I
yeah,
mean, most people were
I
just
think
chilling.
but I think this is not a nature of us chilling. If it was Ebola in China, we would have freaked out.
Hmm.
I think the problem with this is that the percentages tend to be almost perfect to not cause enough worry
Yeah.
and to cause enough damage.
And I
I
think
think
also
though,
the definition of the virus, it's that it's basically a stronger flu,
yeah,
which made
for the
a
most
lot of
part, it
people
still
think,
is.
Yeah, and it is a definition. It's the
but
correct
yeah,
definition.
yeah,
That
and if
kind of made people
yeah.
complacent. I mean, I'm on a Tony Robbins WhatsApp group from an event that I was in Florida in December, and around a month ago, there was a message by Tony Robbins that was shared on the group. That if you hear it now, you'd say, "Man, this guy is an idiot. He's downplaying it. He literally saying, "Oh, this is just a heavy flu. I've never canceled an event in my life." And some people on the group were like, "Wow, you know how the cultish sort of following that Tony Robbins
He
alumni have."
engenders, yeah, yeah.
But some people are like, "Wow, this is very irresponsible of him to say." And then obviously, 2 weeks later, he puts out a written statement on his website that okay, we're going to cancel. Let's be safe. Blah blah blah. But yeah, back to the scale of impact on me as a business owner, sitting at home, digging a hole of debt to stay alive. I have a bunch of scenarios written out that range from complete liquidation to
Wow.
merging with a supplier to just be a stronger entity to survive, to scaling down by 80% just to
Man,
stay alive.
I cannot imagine.
Unbelievable.
Amman and the Middle East has been not doing so well economically, and I think,
Oof.
you know, what I worry about is the unrest. And honestly,
Yeah.
you're sitting in front of a computer doing a podcast right now, and
Yeah.
you're well fed. You're doing the majority of people
Oh yeah.
aren't, and
I mean,
and
listen.
if I ever worried about Jordan is one thing, and everyone's politically sort of the same, everyone's sort of religiously the same, but I think economically, no one. I think that's a one thing Jordan doesn't have, and you know, I worry. And then for the
Yeah.
you lived in New York for a while, and you know, New York will come back. I'm not worried about New York City. New York City will come back.
Yeah.
It's just a matter of when and how,
Yeah.
and what it will look like. And I think there's two theories looking at in two completely separate directions. One is more corporatization of New York. In other words, like a lot of the bigger brand names come in, and you know, they have a lot of cash flow and so on, and they decide to buy up more property and open more branches and so on. And the other is that people are just going to leave because, you know, a lot of people are like, why are we putting up with the crowded spaces? Why are we putting up with the prices? Why are we putting up with all this? And now added to that, and Sandy, you know, we're a low-lying city.
Yeah.
And so why, and now a pandemic with our hospital systems being broken. And so why would we put up with this? So the theory, and which this is one I subscribe to, is that there's going to be an exodus of a lot of people who have means, have families, and older people may leave, which will result in a vacuum of wealth, I think. And it'll be, it'll go back to what it was in, maybe it was what I hope, what it was in the 90s, early 2000s, when there was some grit to New York, the grittiness of New York, the more local feel as opposed to the chains. I know that's a minor thing, but I bring it up with you because you lived here during that, or we lived here during that time. You lived here a little bit before me, and
I
and
arrived
it's
in the late 90s, and it was very gritty, and most retail was mom and pops. Like it
yeah,
wasn't franchise and corporate
yeah,
as it is today. Definitely, it was cheaper, obviously, very much cheaper to be there.
much cheaper, yeah. And it's going to become cheaper to be here. I think real estate is going to take a big hit.
I mean, New York sits in America where you have 300 million people can drive in and out of New York City. Jordan is literally the opposite in every way. Jordan is landlocked politically. A Jordanian citizen cannot drive in any direction outside of
Yeah,
Jordan. Cannot.
absolutely.
I mean,
Yeah,
every country that
imagine, yeah,
borders us is virtually impenetrable unless you have special permission or can just drive out of Jordan.
yeah, absolutely.
And
Which is a
yeah,
scary thought to think when you think about it.
it's insane. I don't know. Jordan will survive. I'm pretty sure it will survive. In terms of social unrest due to economic hardship, I mean, yes, nothing has ever happened at this scale to compare it to. Nowhere that I know of. And but Jordan again is a police state where it's homogeneous as well. And even in terms of wealth class, There are wealthy people in Jordan, sure. But the vast majority, even myself as a business owner, I'm a very small business owner. The money I make from my business is very close to the money that my highest paid employee makes from
Yeah.
as a salary. So we're not talking about CEO pay, where in the US it's like 24 times or 50 times more than their average employee. So Jordan, can it survive? I mean, Jordan is great at mass action. This lockdown has been very well managed overall, although there hasn't been the proper tracing of infected people like the Korean model has been so impressive with.
Yeah.
But there's a huge security and authority apparatus. It's been very well done. I heard they're building hospitals at every border crossing, including near the airport and at the Dead Sea,
Wow.
to manage new
To
coming,
open to open the borders,
to
basically.
open the borders and really quarantine people on the way in,
I
because
think
it's,
that's the biggest thing for Jordan too. The
yeah,
borders are closed completely.
yeah.
Scary, man.
I mean, yeah, people flying in, including Jordanians like yourself. When are you coming back to see your parents? I mean, you're
And
gonna come.
I was gonna come back in June for 2 weeks, and that's done.
Yeah, yeah,
My son's never been to Jordan, and I wanted to bring him, and he's 6 months, and not that he's
yeah,
gonna remember, but it was meaningful for the family.
yeah. But can you imagine like a country like Jordan, whose budget of the government comes from sales tax, tobacco tax, uh,
Oh, and none of that is happening, huh?
and a big chunk is also traffic violation, traffic tickets, and tourism fees. Like when people coming in, people going to
Yeah,
Petra for $100 a pop. These are all zero. I mean, I don't understand how where the government's paying people from right now. It's just nobody's paying taxes end of this month. It's been pushed. There's not a single tourist. There's nothing. There's nothing. Where is it's a gigantic hole. Remember the last scene in Fight Club where
yeah, yeah. I've seen it
where
many times.
the guy is sitting with a view of all the financial district towers, and he blows up all the credit card companies
Yeah,
and gets the debt back to zero. And
yeah,
that kind of like gives everybody, people my generation, the chills back then when you see it, because it's such a fuck you to the corporate system.
yeah.
Now people are talking about, I mean, Trump yesterday, I think, said, okay, student loans, you don't have to pay right now.
Oh no, man! This virus took America from being a capitalist haven to socialist state within 2 weeks, and now
Yeah,
there's universal basic income. Everyone gets a check
yeah,
this month. There's no student debt, so he's basically Bernie Sanders' laws
yeah,
are basically coming into play.
I know.
They're
Yeah.
basically nationalizing healthcare in the sense that insurance companies are told what they cannot do for people with COVID. The people who are being affected the most in this country because of the way healthcare and economics work are the poorer people. You need to pull up an image of the map of New York City and the highest number of cases by zip code, and you can overlay that on the average income, and it's
Yeah.
the opposite. So the highest, it's remarkable. All the workers live in a one-bedroom apartment, but they're 4 people in Queens, and
And
um,
they work in essential services like grocery packing and
yeah, restaurant back in the restaurant.
yeah, deliveries and stuff.
And I was thinking about you and Jenna, since she's into film, and so are you. It'll be a good. I'm sure it exists in some sci-fi film. Some. By the way, you may want to edit out the sirens at some point, right?
New York City, Hadi.
That a movie about Jordan or some other small dictatorial nation being the only COVID-free enclave in the world, with people just fighting to travel to come to Jordan as refuge. The ultimate irony.
Nice. Speaking of COVID-free, Yemen only has one confirmed case.
How do they have tests in Yemen? I don't even know.
I was thinking about that. I think that confirmed case is a Yemeni citizen who flew in knowing that he had COVID. Otherwise, how you're right. They
Yeah.
just they tested and they just found one guy.
Plus,
And
since malaria is a thing back in Yemen, many of them are going to be on the malaria medications.
anyway, so
Yeah, right. The benefits
getting
of being imagine in Hala Yemen will come out the small mini superpower after all economies crumble around it.
Shit, man. You've been in the hospital system in the US for many years. Private hospitals, basically, correct?
Academic medical centers, they're not public
Yeah.
in the sense that they're not run by the city or the government, but
Yeah.
they're private. Yeah, but they're academic. It's sort of the hybrid in a way.
I was watching yesterday Noam Chomsky, who is still alive, commenting on America's performance as a reaction to coronavirus compared to the rest of the world. And his opinion is the same as most progressives, like real progressive Americans, is that the capitalist system that's infiltrated every aspect of American services is always an just-on-time, efficiency, for-profit system that doesn't really allow for, it's not really equipped to manage big spikes that are very rare. Like why would any American for-profit business stock up on something that they'll almost never use? They won't. It's a waste of money. So they just won't have it. They won't have the capacity for it. The government is also very, under a capitalist system, not very big, at least in terms of helping the people. They're big in the military sense. Military-industrial complex is big, but the actual helping regular people, it's not really part of their business. They're mostly a libertarian capitalist approach. So do you feel like this sort of thing is going to change? Should it change is a question, and will it change is another question.
That's a tough question. I think that, and it's no surprise to anyone that the healthcare system is in shambles in the United States. It's privately run in many ways. The insurance system, where the hospitals are privately run, and you're right. As a result, a lot of people are excluded from necessary care. That's where states and state Medicaid and Medicare come in, more Medicaid, and state-run hospitals or city-run hospitals bear that burden, and they tend to be of a lesser quality as a result. I think it should change. The problem, I'm hesitant because it's more complex than just changing the medical.
Is it the insurance system also that's
a lot
entangled
of
with
things.
it?
A lot of things, and I'm slightly biased because I'm obviously will be directly affected. I think that if you're going to change the system, you have to change the medical education system to go with it. The amount of debt, and I know this is not the primary focus of changing medical system, the amount of debt doctors have to leave with in medical school is
Wow.
$150,000 to $300,000. And so why would someone with that amount of debt settle for a government rate income after that?
So you're linking changing a system that's more socially capable of handling these kinds of shocks is automatically going to be a system that pays doctors less because it's more government run.
100%, it has to be.
Okay, but let me ask you this.
When you look at the NHS, like the average income of the NHS, everyone at the NHS who wants to make a decent living works privately. Some of our close friends, the bulk of their income comes from private work that they do.
But do you think NHS doctors have come out of med school with debt? I don't think they do. They don't.
No.
So the American system is broken on many sectors. The educational sector is broken because people come out. Even if you get a environmental studies degree from a good U.S. university, you're gonna on average come out apparently with at least $50,000 to $100,000 in debt.
Yeah, absolutely. And you're never going to be able to pay for that.
You're never going to pay that back. Yeah, that's why millennials are.
Yeah. So I think I think the question is really goes into sort of the entire American system of taking on large amounts of debt and owing that over a period of time. I think that's what the problem is here, and it's similar to these private insurance systems. Our hospitals that are related to academic medical centers tend to not generate that much profit. They reinvest a lot of what they do, and their primary focus has shifted over the course of time. And whereas much of their money and their funding came from grants from the government to do research, now it's clinical care that's sort of driving a lot of the reimbursement and all that. And still, I think we want to change the system, obviously, to a more equitable one so that everyone gets good healthcare at a reasonable price, not necessarily free. I don't think
let me ask something. I'm aware that senior citizens over 65, they have
Medicare, yeah.
And Medicare is decent.
Very good. Yeah.
A lot of progressive politicians will tell you if all you need to do is add a very small tax to certain corporate sectors and to individuals, obviously to American workers, a small tax, and you can expand Medicare for all, literally for all, literally not just bring it down to 60, which is what Joe Biden is kind of saying, oh, let's say from 60 and above, here you go, here's like something for the progressive movement. But if you just add from Elizabeth Warren to Bernie Sanders to even Andrew Yang, they've all talked about taxing Amazon, let's say taxing Amazon 2%, and go down the line from all these giant tech corporations. You can actually afford Medicare for everybody. Is that something?
I would rather tax the corporations because they sit a lot of cash, they sit a lot of profit, and they're going to continue to profit. I think taxing individuals for healthcare, this just specific healthcare tax on after a certain income, I don't think is fair.
But can you imagine
my tax rate is 45% right now. My tax rate entirely, federal, state, city, all that. So you're going to add 8% to that. You're going to say I'm going to keep less than half of my income. Which is what Europe does. Wait, hold on.
Obviously, if you make Amazon pay Amazon and those companies pay the lion's share, you won't be paying an extra. Maybe you'll pay an extra 2%. Whatever you're going to pay. I mean, Bernie Sanders has been very bad at communicating this, but whatever you're going to be paying, you as a mid-range earner in the U.S., you're going to be paying extra tax that is far less than what you will be on average having to pay out of pocket over the years. That's like a fact.
Okay, that's one way to look at it. But the problem with me as having worked in these medical systems and seen hospitals that are city and government run, the NHS probably works very much better than this. But currently, I think a lot of people have a lot of distaste for the government-run hospitals because they tend to be much lower quality.
Yeah.
And so I understand they need more money
because
to
of
get
funding.
Exactly. But it's a chicken and the egg kind of thing. Now I'm going to dump 8% of my, or let's say 5% or 2% of my income and I live a block away from Bellevue Hospital, which is honestly a shit show compared to many other places.
No, absolutely.
Listen, you have to take that off
there's no way. Listen, it's not. For me, as someone who's very left-wing on these issues, I realize it's a multi-pronged approach.
I'm going to be not devil's advocate. I think you're left-wing on these issues until you have to get the care yourself.
No, I get it. And I would definitely want to use my own personal wealth to get the best care when it comes to myself, of course. And I lived in the UK for 3 years, and I have had to go into emergency care at NHS hospitals, and it was unbelievably good. 3 times in a row. And I've visited friends who've been in ERs, and I've visited people who gave birth for free in central London in excellent hospitals, unbelievable hospitals.
Yeah, no, and
this is all anecdotal evidence, but they can do it.
I think the US in general is too big to manage these things very simply. And
I think sorry to cut you off.
It's too varied, yani. I think managing UK healthcare is much less complex than managing the American healthcare, where literally the just by the sheer size of and the diversity of the country, I think.
True, but also can you imagine how much less Canada and the UK have to deal with in terms of the bloated health insurance industry that makes billions? How many billions of dollars is made pure profit, by the way, by the brokers? Just the brokers. I mean, when you buy out-of-pocket insurance, when you buy a non-employer insurance, you have to go through a broker. Imagine those brokers make billions of dollars.
I understand. No, I know, and not only that, on the inside,
the health insurance companies themselves make
they have
billions.
To approve and not approve your.
Oh my God, that's such an admin cost. Admin costs are so high.
But the other side of it, and I'm not arguing this. The other side of this is that what the people argue is that this provides jobs to people who wouldn't have.
It is bloated. Yes, there are apparently 2 million people working across health brokerage, insurance companies. There's more than 1 million people working in those industries. I understand that you can't just tell them, okay, guys, you're redundant as a middleman. Bye. You're going to cause a huge hole. Obviously, nothing like what 2 weeks of COVID is doing to the global economy. But it is bloated. But is that enough a reason to keep it going as it is? Isn't it a smarter idea to kind of start chopping away at it? Maybe by dropping Medicare age to 60. Dropping it by 5 years every 10 years and adding a 1% tax on every American. And then maybe in 20 years, the health insurance industry might actually become much smaller. And that money that they're making, that the billions that they're pocketing, goes to making Bellevue Hospital or whatever
Yeah, no,
public
listen,
hospital a better place.
I'm
Because
with you. I think
it's unsustainable. It's not
no,
sustainable. I mean,
it's a third world country when it comes to that. But the problem this is where America is lucky and unlucky, and they can print money out of thin air, and not many places can do that. And if you look at their
they can,
$1 trillion package to save the economy, think other countries can just decide to. Not, Europe can't do that anymore, obviously, because they're very varied. Small countries can't do it because they can't devalue their currency. Now so I think what's going to happen, unfortunately, is that yes, it needs to change. I'm with you 100%. I think there's still a lot of things to work out other than just the funding of it. I think the way we practice medicine and the way the discrepancies between one hospital and the next should flatten. And I think that may be part of the solution.
That would be great.
I think
but
what America's
that probably won't happen because rich people aren't going to walk into the same. They want to pay for better care. Then they can and they will. It's not like Finland where the richest child and the poorest child go to the same level.
It's because the lowest common denominator is very low, and I think if you raise the bar, and I think if a very long-term view on this, I think personally for fixing America in general, and I think healthcare is part of it, is really, really dumping all this money into education and actually making people a little bit on par with the rest of the world with their education. I think that's the greatest equalizer for making people better competitors in the economy, and as a result, better voters, and as a result, more informed voters,
better informed.
And as a result, more healthy. I mean, if you're if you're more educated, you know how many times I have to tell people that eating canned ramen is bad for you? I mean,
instant noodles,
instant noodles, Coca-Cola, non-diet is bad for you. I mean, it's.
You bring up something funny, Sah. That's such a great point. I think if you watched Bill Maher's New Rules segment from a month ago or 2 months ago, he talks about why don't doctors ask you, doctors ask you, do you have any conditions? Are you a smoker? Are you a drinker? They have this. He's saying, why don't doctors ask people what they've been eating?
That's they do, but he's going to the wrong doctors.
Are you eating junk food? How much junk food do
you
eat?
Do?
How much Coke do you drink? Literally, because that's like the biggest indicator of your health.
I think what you don't appreciate living in Amman and having a car is that we live in what we call, I think they're called food islands or health food islands. If you go to Harlem 6-7 years ago, there's not a grocery store that will sell you stuff that's not canned and processed and bullshit. In Harlem Hospital, the coffee shop was a McDonald's. If you don't allow people to access healthy food, they go for the nearest and the cheapest.
And public schools also serve junk food. Compared to nicer schools.
They're going to be obese. They're going to, and if we're seeing anything, the COVID now, it's very, very clear that obesity is a major risk for death in this disease. And
I keep hearing that about being overweight. Being overweight is a very bad sign. It's a very bad marker.
Very, very bad marker for it. Really, what it comes down to is improving education, and I think everything will trickle from there. And it's not going to be in our lifetime, because you need 1 or 2 generations to change. And I think the problem with the Bernie Sanders approach and all of them is that they want to fix it now, and it's not going to fix now.
Look, I get it that they're pushing for a lot, and from where you're sitting, incrementalist change makes more sense than sudden revolution, obviously.
But the revolution will pull everybody. I get it.
Exactly, the revolution will push you towards it. Especially when it's on the table, it makes people understand that it's possible to ask for free healthcare, and it's possible to ask for free college and all that stuff. I want to hammer home more of my disdain for the American healthcare system. Although I love the quality. My 3 children were born in DC. And every single time, it has been an unbelievably great experience.
You have to talk to our friend Omar Alwer, who's building a hospital in Jordan, and he had visited a lot of NHS hospitals and a lot of American hospitals. And you should talk to him. I'm not going to quote him, but you can talk to him. And I was so shocked by how big, from his perspective at least, how big the difference is with regards to advancing medical care, advancing medicine, and providing medical care.
In favor of which hospitals?
The American system.
Americans being much better.
He said the British system is years ahead of the Jordanian one, and the American system is hundreds of years ahead of the British.
Listen,
one.
That's
British one, not the
that's
Jordanian
true.
one.
I'm not surprised. I mean, my brother-in-law did 2 years of hospital work as a doctor in Texas and New York City, and the tech that they're used there is he was blown away, and he blew us away with the stuff that they're using there compared to Ireland, which is where he practices now. No, that's obvious. That's something we can't argue.
You ask why the system is not going to change, and it's similar to the COVID thing. It's a really good analogy, because for you as the individual, when you go through the system and you're insured, which are still the majority of people, they are insured. The experience is actually quite good. It's not that bad of an experience for someone who has private insurance. Into you who's so against the system, yet you applaud it for being actually a good experience.
Because I had insurance.
I understand that. For as a voter who has that insurance,
oh yeah,
you're going to look at the system and you're like, what's wrong with this? This
exactly.
Or get better insurance, or this is not really a problem for me. And so culturally, you're not going to be able to change people to think, why would I want the federal government, which really is inept in many ways in this country, especially now, to run this show when private enterprise is doing a much better job.
Yes, and private enterprise does a great job because they're very incentive to be profitable, hence their incentive to have excellent service. Absolutely, it goes hand in hand for sure.
Attract talent
big time with big pay. But is the U.S. going to wait until the number of people that are being trampled on because the health insurance system is profit before people, basically? Insurance companies that are in charge of accepting a charge. Let's say you have a procedure that's kind of elective, but it's kind of an emergency. It's halfway in between. The insurance company that you've been paying, your employer has been paying for years, is going to fuck you. More likely, going to fuck you over. If they end up, they're saying, okay, it's all right. I get it. The insurance company needs to make money. That's not how it's supposed to be, because healthcare. This is the analogy that a lot of progressives use. When your house is on fire, everybody pays in for the fire department. I know it's a much smaller bill, and your house isn't going to burn down in your lifetime. Most likely, you'll never burn down. But it's the same thing. You're not supposed to get different kind of service when your house is burning down. Should be the same thing for your body. Of course, the libertarian and capitalist and right-wing way to think about it is like, oh, if you're overweight, fuck you. You're going to be your bill is going to be huge. You're going to be a drain on our community. So what? That's true. It's the same way unemployment checks. There's going to be freeloaders that want to sit at home and play Nintendo all day and collect their check. But because of those 2%, you're going to make 10% of the population who actually are hardworking skip out on it. This is the whole issue with...
it's an individualist society here. That's really what...
Absolutely. The number of people in the U.S., and I wish I'll bring up maybe the stats later, that are unhappy with their employer, unhappy with their job, but are sticking to it because they're afraid of losing their insurance.
Yeah, I remember you about this.
People are not willing to leave their jobs.
So can I ask you a question? Can I ask you a personal question?
Yeah.
Why does it bother you so much? You don't even live here.
You're right. Why does it bother me? Honestly, I used to pay $450 a month to, I think it was Aetna or Blue Cross, something like that, every fucking month for 6 years. Just so my wife gives birth in her hometown in Maryland, and there's God forbid, a complication. I don't get stuck with $100,000, $200,000 bill. And that money for me was so painful to pay. And then the insurance broker shaves a lot of money off of that. I think 30% goes to the broker who does nothing. The broker literally tells you, the premium's this, the deductible's that. And that company makes literally $1 billion a year in turnover and makes $100 million in profit for doing nothing, for being the middle. So for me, when I think about moving to the US, I think about that every day, leaving Jordan and moving to the US and being an entrepreneur in the US. I think about, oh my God, what if I get into an accident? I'm going to get bankrupt. The figures about people, entrepreneurs that don't have insurance, that go bankrupt from medical bills is insane. And that doesn't happen in Canada, doesn't happen in UK, doesn't happen in 30 countries around the world.
Yeah, but the thing is here,
that's why I'm passionate about it.
That's also the minority, right? The majority of people are insured through their jobs. So I never with a broker, and I barely pay into my insurance. That's another reason it's not going to change it.
Hadi, thank you so much. Dr.
My pleasure.
It's been awesome.
Don't call me doctor.
Doctor, I've never called you doctor before.
No, I don't think you should ever again.
It's been great, man. Thanks a lot.
Thank you. No, good luck with the endeavor. Let me know if I can help in any more.
Yeah. And like I said, you can, if you want this mic to jump in with an interview of your own, as part of the Saudi Arabia podcast. This platform is, it's not just for me.
We should say goodbye like زي اللي وراك يعني. Goodbye.
Bye bye.
Bye bye.